Welcome to the Long COVID podcast with me, Jackie Baxter. I am really excited to bring you today's episode. Please do check out the links in the show notes where you can find the podcast website, social media and support group, as well as a link to buy me a coffee if you are able. You should not rely on any medical information contained in this podcast and related materials in making medical, health-related or other decisions. Please do consult a doctor or other health professional. I love to hear from you. If you've got any suggestions or feedback or just want to say hey, then please do get in touch. I really hope you enjoy this episode, so here we go. Hello and welcome to this episode of the Long COVID podcast. I'm really excited to welcome my guest tonight, Dr. William Lee, who is a physician scientist, president and medical director of the Angiogenesis Foundation, I hope I pronounced that correctly, and best-selling author of Eat to Beat Your Diet, Burn Fat, Heal Your Metabolism and Live Longer, which will be hitting the shelves, I believe, in about a month. So Dr. Lee is leading research into COVID and long COVID, which is what brings him here today. So a very warm welcome to the podcast.
Thank you, Jackie. It's a pleasure to be on.
Amazing. Thank you so much for being here. So to start with, would you mind just introducing yourself a little and just telling us a little bit more about what it is that you do?
Yeah, sure. Well, I'm William Lee. I am a physician. Internal medicine is my background, my training, which means that I take care of men and women, young and old, healthy and sick. And my goal has always been to try to keep people as healthy as possible. And even when they get sick, actually try to restore their health with whatever tools are going to be most useful. And that's actually relevant to long COVID. I'm also a scientist. What I'm known as is a vascular biologist, which means I study blood vessels, which is actually affected in acute COVID as well as long COVID. And so I was one of the early researchers to discover that COVID is not just a lung disease, a respiratory disease, but in fact, the coronavirus invades your blood vessels. And so very early on, I became acutely aware and started to participate in doing the deep dive to figure out what was going on, what were the implications, and now following that trail to long COVID. So that's my research world. And as an author of two books, my first one was called Eat to Beat Disease, was really about how the body maintains health. And although it did talk about food as medicine with a lot of foods, the reality is the focus was what are the functions by which the body remains healthy, maintains and protects its health, and how does it get knocked off that pedestal, which is very relevant to COVID and long COVID. And my next book, which is coming out in March, is called Eat to Beat Your Diet. And that's a trick title. It's not a diet book. It's actually an anti-diet book that really talks about, as a sequel to my first book, how do we actually improve our metabolism? How do we gain energy? How do we actually remove some of the factors that actually wear down our health? And again, for people who are struggling with long COVID, being able to master your own metabolism is likely to be one of the important angles to be able to restore your normalcy. And so with all these things in my background, I before the pandemic, I spent a lot of time in cancer research. I helped to develop more than 43 FDA-approved treatments for cancer, complications of diabetes, and vision loss. And so when the world suddenly got hit with the pandemic in the spring of 2020, rather than sit back and wait to see what was going to happen, I literally sprang into action to see what I could discover, what I could contribute, what I could learn. And man, it's been a lot, including long COVID.
Yeah, I mean, from a sort of taking a step back perspective, it must be a completely fascinating time to be a scientist and a researcher and a doctor. From a patient's perspective, it's a really terrible time. But taking the patient hat off, I can kind of see.
Well, most of us who went into medicine, went in because we truly wanted to contribute to people, to help people live better, longer lives and help them get through difficult spots. If you think about it, before the pandemic hit, there were no COVID experts because COVID, in fact, is a brand new human disease. You're right in two respects that it's an exciting time. It's an exciting time for researchers because we're trained to tackle the unknown. So rather than, just sort of be frozen with fear, those of us who had research backgrounds like me were able to lean in to say, how do we take the modern tools and start to grapple with this beast that suddenly emerged, out of our windows? And the other aspect that you say, a frightening time for patients, I would say for those of us who have worked in this space, it's also been, how would I describe it, sobering, eye-opening in a astounding and slightly shocking sort of way. And also, I will just confess on a personal level, somewhat frightening, because what we're seeing is here's a disease that we don't fully know how to treat. It didn't exist before a few years ago, and for which we don't really have tried and true therapies at our fingertips. And that's not a good place for science to be. That's not a good place for doctors to be. And, at least from my perspective, and I've cared for many, many patients, people with long COVID. I don't even call them patients, like people with long COVID. It's kind of like diabetes. You don't want to be called a patient. You're just a regular person, but you're struggling with this, difficult, slippery syndrome. I've cared for a lot of people with long COVID, and I've tried to make some headway using science, and to some extent have had some success. So, yeah, so I'm here to put my effort forward to help folks like you.
Well, I certainly appreciate it, and I'm sure everybody else does as well. So I guess let's dive into all of this. I think probably like every long COVID person, we've all kind of done a lot of Googling and a lot of, Twittering, if that's even a word, and kind of trying to do our own research and sort of hack our way through this almost. And I find myself, spouting medical terms that I wouldn't have even imagined before. Anyway, the most recent one that I came across, which I think is probably what led me to you, was this VEGF. So is that maybe a good place to start? What on earth is it?
Well, look, let me frame this for you because you just served up some alphabet soup, which is what we say, in the research world, the medical world. There's many acronyms and abbreviations. VEGF, I will tell you what each letter stands for. V is vascular, which means blood vessels. Endothelial is one of the main cells of blood vessels. And GF stands for growth factor. And growth factor is kind of a fertilizer for blood vessels. So let's talk a little bit about that. But before we get into VEGF, I want to frame how COVID affects blood vessels and what we're actually learning. As a researcher, what are we learning about long COVID and blood vessels? Because it's really, really profound. In the beginning of the pandemic, one of the things that the medical world fully expected was, here is a virus you inhale. It causes coughing and respiratory congestion, fever, kind of like a pneumonia, like other respiratory symptoms, except that in addition to being a really, really serious respiratory disease involving the lung, respiratory, there were really odd things that were also manifesting at the time. And if that sounds familiar to your listeners with long COVID, that's surprising manifestations. I'm pointing this out because we saw it at the very beginning, at the get-go. Let's call it March 2020, maybe even before. What are some of these odd things? Well, we saw people having strokes. That's not what you normally get with a respiratory disease. We saw people having COVID toe. It's a red, beefy, painful toe. Also not really common that you would see. We saw people getting blood clots all over the place in their kidneys and their livers and in their heart. I mean, just odd. That doesn't usually happen with COVID either. So this really started to draw my attention as an expert on blood vessels to ask, why were blood vessels apparently being involved in a respiratory infection? The respiratory system is your lung, pulmonary system. You got two lungs, you got a bronchus, you got some airways, and then you got the mouth and nose, nostrils that the viruses are inhaled through. Like, how would it actually get to your blood vessels? Well, we actually mounted a research effort to figure this out. So this was back at the end of March 2020, very early on, with some colleagues of mine. We actually got autopsy tissue from the first people that died of COVID, and we were able to organize a team of molecular anatomists. So think about, there's a TV show in the US called CSI, Crime Scene Investigation. And like literally that's what I did. I was working with people that could actually dive right in to the tissue of the first people to die of this unknown disease. And we went through every organ, every tissue at every level from which you could see with your eye, way down to the microscope, all the way down to the genetic level, to the DNA level. That's why I'm bringing up crime scene investigation. It's kind of like looking for the blood splatter on the wall, like what's going on? And when you go down to that level, there's really no secrets because you can find everything. And it took us less than a week to discover why blood vessels were involved. The clotting, the strokes, the toe, the heart problems. And it turned out that we were actually saw with our own eyes the first pictures of the coronavirus creeping into the cells, invading the cells comprising the blood vessels, the endothelial cells, the E of the VEGF, vascular endothelium. And we actually saw pictures of these, and they were literally just, it's kind of like army, like parachuters coming out of the sky. These are from the viruses, and the viruses are literally landing and penetrating into the ground and getting into your blood vessel system, getting into your circulation. And from there, they were spreading and damaging your circulation. And what kind of damage are we talking about? We're talking about, and we did this at the genetic level, we were able to literally peel open the blood vessel cell and look at the parts in the cell and then look at the DNA. And I can tell you that this coronavirus was turning off healthy DNA and turning on unhealthy, dangerous DNA. It's kind of like, having a burglar break into your house and go straight to your electrical system and start pulling the wires and the fuses out. All right. I mean, really, it was awe-strikingly scary to see this because we started to realize, man, this is not your typical respiratory virus, but it gave us the first clues. That's why blood clots were going on. That's why damage to the blood vessel system were going on. That's why strokes were going on. And we published this as a lead article, as a headline in the New England Journal of Medicine, which is one of the most prestigious medical journals in the world. And that led me and my team to get pulled straight into the center of the pandemic. I had no intention of doing this, and it was not my field because nobody was an expert in this. But I felt like because this was a contribution that I could make, that I would literally just, dive into the deep end of the pool and start swimming. So I've been doing this since the beginning of the pandemic, digesting, doing research, trying to figure out everything I can. And during the period of long COVID starting to emerge, about summertime of 2020, so when we first starting to see the survivors of the early COVID starting to complain about these really unusual problems: intense fatigue, muscle aches, lack of taste and smell, and nerve tingling, you name it, the difficulty breathing, the rapid heart rate, the POTS syndrome that I know you covered on the show before. We started to immediately ask, wait a minute, since we know blood vessels are damaged in the acute disease, meaning right after you get infected, what was the evidence? Could there be continuing damage to blood vessels that could explain long COVID? So one of the amazing things that we did is we actually we contacted patients who were actually having real difficulty breathing, no energy, months later. So this is like July, August 2020. And they basically said, Dr. Lee, I went to my regular doctor and I complained about my long COVID, and they did an X-ray, they listened to my heart, they even did a CT scan, and everything looked normal. My blood tests look normal, and I'm testing negative for COVID, and I'm really frustrated because nobody can figure out what's going on. And I feel terrible when a doctor isn't able to provide some informative answer to a patient, because when you're a patient, even bad news is a better answer than having no news, or even worse, kind of being written off as sort of just somebody who's got something going on in their head, right? Like that's gaslighting, terrible thing. So because I'm a researcher, I basically said, well, can you give us your scans? And let's go ahead and take a deep dive and look at the scans. So there is a technology that I was introduced to through the FDA that takes CT scans that might look normal, and it takes the scans and it deconstructs the CT scan, CAT scan, slice by slice by slice by slice, so 10,000 slices, and it reconstructs the blood vessels. And there are, against the backdrop of about 1,000 normal, healthy lungs and their circulation, we were the first to see, astoundingly, that in long COVID, small blood vessels were still missing in patients who had suffered acute COVID. In other words, getting COVID at the very beginning can wipe out a lot of blood vessels in your lung. That's why you're having such problems breathing, damaged blood vessels. We saw this, published it. But even in the people with long COVID, their blood vessels were still damaged and hadn't recovered. In other words, here was damage that was hidden in plain sight because a CAT scan would not capture the blood vessels, X-ray wouldn't capture it. You can't hear it with a stethoscope. So a doctor would not be expected to find this, but using technology, we were able to reveal part of what was going on. So that led us to dive deeper and deeper and deeper. When blood vessels are damaged, one of the things that they do is they release factors, proteins, when they're damaged, as a way of trying to grow themselves back. Okay. One of the ways that they try to grow back, like for example, if you cut yourself, paper cut, you scrape your knee when you're ice skating or rollerblading, once you put a Band-Aid on, what happens is that your local tissue, because the blood vessel's been damaged, they'll release this protein, this fertilizer called VEGF, vascular endothelial growth factor. It tries to grow itself back. In fact, if you've ever had a scab that fell off too early, the scab on a wound, and you look underneath that scab, the black scab comes off, it's all bubbling red, bright red. Those are lots of little tiny capillaries, little tiny blood vessels growing back. And they're growing back because VEGF, the damaged tissue release VEGF, vascular endothelial growth factor, they just get more blood vessels to grow. So one of the things that we believe is that as the people who have injured circulation in their lungs are desperately trying to grow back their normal circulation in their lungs, they're releasing VEGF, or VEGF is what we actually call it. And that's a biomarker, we think, that might be one sign that your blood vessels are damaged and your body is trying to repair itself. So it's not the only thing, but it may wind up becoming a very important telltale marker of what's actually going on.
We'll be right back. I'm interrupting myself for a second to tell you about long COVID breathing. The fabulous Vicky Jones and I have teamed up to bring you long COVID breathing. We are both passionate about sharing our expertise and experience of the breath and how incredibly helpful that can be with long COVID. We've worked together to develop a course that is specifically tailored to those with long COVID. It's a 6-week course with 12 sessions, all delivered online. The community feel and learning that we're all sharing is such a joy. To find out more information and to sign up for our courses, workshops and other shorter sessions, please check out the link below, longcovidbreathing.com, or email longcovidbreathing@gmail.com to start your breathing journey with us. Wow. That's kind of blown my mind just a little bit. I think one thing that we as long COVID people have struggled with, I think, and it's probably the same for doctors actually, is that there isn't like a test you can do for long COVID. There aren't really biomarkers, but actually maybe there are, which is quite cool. But, that's absolutely fascinating that this VEGF, or VEGF, you said, is basically a sign that the body's trying to fix its blood vessels.
Right. So rather than think of it as a disease marker, like a tumor marker, right? So if you basically have, a blood marker called CEA for colon cancer, like the higher the CEA, the more the disease. This looks like a health marker, and it's it may wind up being your body sending out not a distress signal, but a signal that you can look at that says, hey, we're trying to fix ourselves. Something's not well. And it's like seeing bags of fertilizer on the driveway of a house whose garden needs to be repaired.
Right. Yeah. So it's a sign that there's something wrong, but it is also a sign that your body's trying to do something about it.
Exactly, exactly. So now, let me just also use this as a opportunity to say, because I'm a researcher, I am very interested in understanding fundamentals. Like, what is the common denominator? What is the underlying reason that we actually have any disease, whether it's cancer, diabetes, heart disease, Alzheimer's, whatever it is? Because ultimately, to find a cure, to really overcome a disease and help patients, all the big breakthroughs, okay, throughout the history of medicine has come from understanding what's going on underneath. And if you know what the target is, what the problem is, then you can send in a road crew to try to fix the potholes, rebuild the bridge, or if there's an enemy at the gate, actually where to throw the spear, in order to be able to get rid of the monster, right? So, I mean, I'm giving you these analogies because they're easy for your listeners to understand, but that's really how medical researchers come at this. So I've been really interested in saying, what are the final common pathways, the underlying common denominators of all these 200 plus symptoms of long COVID? Because, you pointed out long COVID isn't one thing. There's no one biomarker. There's not even one symptom. And so one of the struggles is really, how do you define it? Is it one of three? Is it three of five? Is it you have to have all 10 things? Like doctors like to have these check boxes to figure them out. But honestly, if you're a person who is suffering from long COVID, you don't need the boxes. You just know that you're not right. And so I'm interested in figuring out, like, what could be going on that might manifest in so many different ways. So there's three things. Let me just tell you the three legs of the stool of long COVID as I see it. And again, don't let anybody fool you. There are no experts in long COVID. Anybody who's working in this is just, we're all students. We're trying to figure this out. All right. We're all explorers to some extent. So the three legs of the stool that I see, given my background and as a researcher, number one, microvascular damage, blood vessels, small blood vessel damaged. Okay, that helps explain a lot of things. It explains, your fatigue. You don't have good blood flow. Your muscles are tired. Your brain fog. By the way, we've actually seen in people with severe COVID that the lining of the blood vessels in the brain are ripped out, like ripping the foot out of a sock, and the sock just collapses. We see this in like the thinking part, the executive portions of the brain. Pretty frightening when I tell you that, right? Like when I saw the pictures of that, I'm like, oh, how can that be? Like how bad a situation is that? We got to figure out how to grow microvascular damage. Okay, we see it in the heart, we see it in the brain, we even see it in the testicles. All right, so I mean it's everywhere. So that's number one. Oh, by the way, lack of sense of smell. Oh, I don't taste so. I can't smell the same way. Your olfactory neurons, the nerves that manage to help you interpret the apple pie smell wafting in the air, that connects a signal to your brain that knows what an apple pie is. The way that works is that it has to be kept alive and functioning with blood vessels. When those blood vessels are damaged, your smell sensors don't work as well. Okay, faulty wiring, so to speak. So that's one leg of the stool. Second leg of the stool, and we're seeing this now, there's a low-grade autoimmune disease that COVID infection sets off in some people. It's a trigger. You don't have to have had autoimmune disease before. You might have never had autoimmune disease, okay? But this infection in some people, not all people, but in some people, triggers an autoimmune response. And that autoimmune response seems to persist long after the coronavirus is gone out of your body. So you test negative by PCR, but this damage is still continuing, right? So it's kind of like the careless cigarette smoker who's going on a hike through the woods that lights their cigarette, and when they're done halfway through, throws that burning butt into the dry woods and then just leaves the woods, right? So the coronavirus, the smoker is gone, but the cigarette butt has been lit, and now you've got a smoldering fire in the forest. All right, that's like the autoimmune disease. All right. You don't have big, long, raging wildfire, but it's a smoldering that's actually going on. And we know this, by the way, because we actually have seen in children and adolescents who are surviving from COVID, they actually develop higher rates of type 1 and type 2 diabetes. Now, the type 1 diabetes is an autoimmune disease. Increased signs of lupus like illnesses, increased signs of arthritis, which is these are all autoimmune types of conditions. We're seeing this, problems with thyroid, we're seeing that as well. So here's an infection that once it goes away, and some people can trigger off an autoimmune disease, second leg of the stool. All right. Third leg of the stool is chronic inflammation. All right. This chronic inflammation. Now, we all know, if you've read anything about health and wellness, and foods, have your anti-inflammatory foods, like inflammation is bad for you. Look, if you're a young person or an old person, if you've got a little bit of inflammation, it's actually good for you. So basically, if you had surgery and you had your appendix out or your tonsils out or a tooth pulled, you're going to have a little inflammation to just, fight off any bacteria that's nearby and then heal up. A little inflammation is good. A lot of inflammation is extremely dangerous because it's like that smoldering fire I was telling you. Okay. It's actually low-grade inflammation burning through your body at all times. It stresses out your metabolism. It completely throws your systems off of whack. And it sets up for all kinds of other dangerous diseases, including heart attack. I don't know if you read this, but a new study showed the rate of increased fatal heart attacks in young people under 44 is elevated by 43% in people with COVID, including Omicron, which isn't that serious. 43% increase in fatal heart attacks in people under the age of 44. Okay. Moment of silence there, because that is extraordinarily sobering. That can happen with damage to the heart blood vessels. That can happen with low-grade inflammation. This is the kind of problem that we all need to solve. All right. And, those of us who have worked in cancer research, we're also worried about the specter that this smoldering inflammation could later on lead to higher rates of cancer springing up months or possibly years or maybe even decades later. So this is why, for me as a researcher, we have to jump into this long COVID thing to understand it. But if I told you that microvascular disease, autoimmunity, and chronic inflammation were underlying problems, there's a little silver lining in that. We have medicines that we can work for all three of these issues. Okay. There's something we can do about all three. So this is where we are. Like, I've taken you right to the precipice of long COVID research. And I know you've had many, many other brilliant speakers join you on this podcast. But from my perspective, my career has been in developing new treatments and also looking at food as medicine. Once you know that there might be three areas that you can tackle, then you can actually shift your focus away from fear and panic and sort of flailing into saying, let's focus on what we believe is going on and see if we can actually rectify it.
We'll be right back. Hey there, I'm just jumping in for a second to see if you're enjoying this episode. If you're finding it useful, maybe you would consider sharing it somewhere, a friend, a group, or even on your Twitter feed. If everyone was able to share just once, we'd be able to get this information out to even more people who really, really need it. So please consider sharing somewhere if you possibly can. I hope you enjoy the episode, and thank you so much. Yeah, I mean, the word flailing, that very, very aptly describes my first at least the first year, probably the first 18 months of this. I had no idea what was going on. I mean, I think most other people didn't either. We were sort of in fully pandemic mode, and, I was going to say no one was really that fussed. That's not quite fair, but, doctors were so overloaded that it was almost like they could only do so much. And then once a bit more information started to come out and you start to hear people talking about things like autoimmune diseases, and you're like, oh, what's that? I don't know. Let's ask Google, which isn't always a good idea. But then you can sort of start tackling these things a little bit. And Since I start taking legs out of the stool, I'm not sure that's a good idea either, because then your stool falls over. But once you can start tackling things.
Yeah. I mean, actually, when you see those legs in the stool, that stool is not one you want to sit on, right? So what you want to do, in fact, is you want to actually figure out how are you actually going to build health around those problems. Okay, those are weak legs of the stool, but they may be underlying causes. So, like I said, the good news is that, there are ways that we're looking at how to actually address and treat. And I'm just going to tell you some of the experimental ways that we're thinking about this. So you may not be surprised that, for inflammation, we've got anti-inflammatory diseases. So there's a number of different treatments that are used for menstrual cramps, for arthritis. It's a whole range of interventions. Some are inexpensive and easy to get. Some of are very sophisticated and you have to infuse them into your vein. But anti-inflammation, we know how to deal with that. Okay. But we need to do the studies to really figure out what's the right approach. The autoimmunity, well, that's, if you talk to a rheumatologist, they'll tell you, autoimmune diseases are much more easily managed today than they were a decade ago. We have some pretty powerful treatments that we can actually use to bring lupus and rheumatoid arthritis under control. But it's still not something that is easy to contend with. And some of these treatments, the powerful treatments, are very expensive. And depending on where you live, I mean, COVID didn't never cared where you live. I mean, it just took you down whatever corner it happened to find you in, kind of like a tsunami washing onto the beach and into the town. The fact of the matter is, those very sophisticated, highly effective autoimmune treatments are not going to be readily available for most people. So again, I think that there's going to be an avenue of innovation and treatment to look for who needs to get those and which ones might work better. By the way, one of them, baricitinib, is a treatment for rheumatoid arthritis, big autoimmune disease. That's actually approved in Europe and the United States to treat acute COVID. It's life-saving. All right, just to give you an idea of how powerful this autoimmune component actually is. But people, because long COVID is one of these, don't worry about it. You tested negative, you're fine. Go back to work, go back to your life. And now we live in a world where, I think that, people call it pandemic fatigue. But honestly, I think that it's something revealing about human nature, about our humanity, that our species is just not well suited to contend with an existential threat for a long period of time. We just can't, most people can't deal with it. And so that's why everybody's just going back to work and pretending nothing's going on. But, those of you who actually have been grappling with this, like once burned, twice much more cautious, right? And I think that that's really where we need to actually rally people together to look at this autoimmune component. And one of the simplest ones, just to give you an idea, by the way, this is the first long COVID podcast I've done other podcasts and media shows like talking about long COVID, but I think, being that this is something specifically for long COVID, I'll share with you as a researcher some thoughts. Look, we have very effective treatments, simple treatments for autoimmune disease that involve steroids. Prednisone, dexamethasone. Oh, dexamethasone, by the way, is an approved treatment for treating acute COVID. So should we be, kind of carrying a page from the playbook of acute COVID and thinking about how to use it to actually provide relief for some patients, not necessarily all patients, for whom the autoimmune symptoms are more severe? Don't know that yet, but it's worth a try. And again, I think that what we in the medical community have a responsibility of doing is leaning forward so that our patients don't have to flail. There can be some, even if it's trial and error for a new human disease, we need to trial and hope we don't make an error, but that's a judgment. We have to use our best judgment on behalf of the individual. Okay, so that'd be an example for the autoimmune component. For the vascular component, blood vessels, this is my wheelhouse. I cook in this kitchen, all right? So I know a lot about it. There are treatments that can actually grow blood vessels. We use those to heal wounds and diabetes. There are treatments to get rid of extra bad blood vessels. And by the way, one of the odd things that acute COVID does is as it injures your blood vessels, it triggers a repair response that's not quite normal. And so your blood vessels have, at least in an acute disease, have difficulty fixing themselves. They don't quite get to where they want to be. So now you have an injury that can't quite fix itself. It's like a free that has, damage to a branch and it's trying to regrow the branch, but instead of doing it properly, it grows a nub, a gnarly nub instead of a nice branch. We see these nubs actually happening in acute COVID as well. So what can we do to try to normalize and repair, restore, regenerate a normal circulation? Well, there's a lot of research going on in that area, and I think a lot more should, and will go into this area if I have anything to do with it. But I will also tell you that I'm going to throw something out there that might surprise your people, and I think I'm not telling people to go out to do this, but I do want to give some hope and stimulate a conversation that they might bring to their doctor, to explore whether or not something is reasonable. But it turns out that one of the things that can help repair blood vessels is a natural substance called nitric oxide. Nitric oxide is something that was used early in the pandemic to try to save people, pregnant women, from going on a ventilator. All right, and it actually worked. So we knew, what does nitric oxide do? Nitric oxide dilates blood vessels. Okay, it also causes your body to move stem cells out to regenerate blood vessels as well. It's a regenerative force. It'll actually help you regenerate organs as well. So nitric oxide was used early in the pandemic to really test to see if we can do repair. Again, nothing yet moved into the long COVID clinic and in clinical trials, but it really needs to kind of go in this direction. And I think that there are some efforts starting now. The other thing that you can do with nitric oxide, do you know, and this might be interesting for people to hear about, do you know that you can eat food that will create nitric oxide in your own body? Okay, so let me tell you, you've heard about, like hot dogs, sausages, wieners, right? And preserved meats like not being good for your health because they contain nitrites, right? Well, it turns out that when the processed food factory pours them into your packaged meats, that's not so good for your health. However, you can normally get nitrates in your food, healthy nitrates, from the soil. Turns out spinach and beets are two foods that grow low to the ground, and they absorb plenty of normal nitrates from the soil naturally. So when you actually eat beets or drink beet juice, or when you eat spinach, and this is the interesting part, if you take the time to chew the spinach or, like slowly sip the beet juice or chew the beets, all right, so you got to make it tasty. Anybody who wants to do this, make sure that you look up a tasty recipe. I can give you some. I like to cook, so I have lots of recipes for tasty beets and tasty spinach. But when you actually take the time to chew and savor it, what happens is that the microbiome, the natural healthy bacteria that grows on your tongue, most people think of microbiome in the gut, it's on your tongue, actually interacts with the nitrates in the spinach or the beets. And then when you swallow it, it gets converted into a form that your body absorbs as nitric oxide. So eating beets or spinach, and this has been studied in humans, generates natural nitric oxide if you chew it and let your tongue bacteria actually interact with it normally. Okay, little sort of like hack for yourself, and that can generate nitric oxide. Good for your blood pressure, lowers your blood pressure, makes you a little bit relaxed, but it also stimulates stem cells from your bone marrow to help repair organs. You can regenerate from the inside out, repair yourself from the inside out. So one of the interesting things that I've been looking at as a researcher in food as medicine is, can we, on one hand, eat anti-inflammatory foods that could be useful for suppressing some of that smoldering fire, maybe pushing back on some of the autoimmune disease? And can we actually try to look at foods that can generate nitric oxide to repair blood vessels as a more natural way to do this? And this is one of the things that I have been working on and writing about is, in the era of COVID, what are some of the tools that we can use to empower ourselves so we don't have to wait for the doctor? We can practice some interventions on our behalf in our kitchen, and as long as they taste good, they may be good. Now, I'll drop one last zinger at you that you might not have expected. There is a medicine, by the way, that increases nitric oxide in the body. And again, I'm not giving medical advice here. I'm just telling you as a researcher, something that people should know. And it's something that, as a physician, I've actually looked at this a bit myself. But it turns out that Viagra actually causes your body to produce nitric oxide. Viagra actually causes your body to produce nitric oxide, which dilates blood vessels, which brings more blood flow to the penis, which then restores erectile function, and it causes stem cells to come out to repair damaged blood vessels. Now, low dose Viagra, to give Viagra to a 50-year-old diabetic man for erectile dysfunction, you have to use really high dose Viagra. But low dose Viagra is approved for babies in the ICU with lung damage to their blood vessels. Now we're coming full circle back to long COVID and the discoveries that I mentioned to you. So interestingly, there is an avenue of research looking at whether or not Viagra, giving that lower doses, could help to repair those damaged blood vessels in the lung.
Wow. I mean, that's amazing, isn't it? And you've mentioned loads of things. If it wasn't like the middle of the night here, I would be off to the supermarket to buy beetroot and spinach. You've just mentioned for your three legs of your stool, three existing treatments that are already there that could be used to help people with all three of these things. I mean, that's really good news, isn't it? That they're already existing and they could just be kind of shuffled out to people to help.
I think that there are people that are in need right now that could be empirically helped using the thinking that I described, which is that what could be going on underneath? What do we have that's currently available that might be helpful? Can we try it under supervision of a doctor to see if it would be useful? And if it's useful, how do we manage it? How do we measure it? How long do we keep it? There's a lot of questions out there. Of all the things we talked about, there's more questions than answers. But I do believe, and I do agree that, we're moving into a hopeful phase where rather than just being overwhelmed by all the unknowns, all the horrible, terrible, painful, uncomfortable unknowns, that we're beginning to really think about like how to fight back and how to kind of take back our health. And might there be some tools? Now, I do think that there's plenty of room to develop new treatments for long COVID. I think we've hardly begun, actually. And we do need to begin because as a doctor, I can tell you, I want something out there that if any of my patients who have had COVID wind up becoming people who are suffering from long COVID, I want to know that there is something that I could prescribe that could help them. And it may not be one thing, it may be a bunch of things. I want to know that. I think that in the 21st century, humanity deserves to apply its medical know-how and technology to be able to develop truly effective treatments. I mean, if we can develop immunotherapies that can literally dry erase cancer from someone's body, which we're starting to see now, then we absolutely need to apply that kind of advanced thinking and advanced technology into trying to help people with long COVID. This is a new human disease. I wrote an article with Dr. Andy von Eschenbach, who's the former commissioner of the US FDA, in the Washington Post. This was back in the fall of 2020. We saw this coming a long time ago. We said there's going to be a second pandemic to come out of the first. And that second pandemic is going to be long COVID. And there's going to be a lot of blood vessel damage that needs to be jumped on. And we need innovators to come in there and really start to see what we can actually do. So I do think that there's a lot of room for drug development, diagnostic development, better imaging, better testing. But in the meantime, for people who are struggling, I think there is an opportunity to look at food. Food is medicine. There's an opportunity to look at repurposing existing medicines. Oh, and by the way, this might be of importance for people who are listening who may have had COVID the first time and have gotten it again, or maybe this is their first time having COVID and they're interested in, trying to figure out what should I be worried about for long COVID. Well, it turns out a recent study just showed that, and this was a clinical trial, like an actual clinical trial, looking at people diagnosed with COVID and by PCR, and then treated with one of three medicines. One was metformin, which is a diabetes medicine. One was ivermectin, which is a anti-parasitic drug. And the third one, I don't think it was hydroxychloroquine, but it was I can't remember the third medicine at the moment. But I will tell you that one of those three, and it turns out to be metformin, decrease the risk of developing long COVID by more than 30%. So being treated while you have acute COVID with metformin, at least this is what this clinical trial showed, seemed to lower the risk of developing long COVID. Of course, so does vaccination, and we think boosting will also be very important as well. But the fact that we can actually start to think about a medication, again, metformin, it's been around forever. It's a safe, inexpensive pill that has very few side effects, that's used to treat adult onset diabetes. Could that be a new medicine that for newly diagnosed COVID patients, a doctor should prescribe that in order to be able to lower their chances of developing long COVID? All unanswered questions, but really, really promising. And as a doctor who has been involved with long COVID patients, I think optimistic and exciting for doctors, because we're starting to think maybe we're going to have some tools.
Yeah, I mean, that is amazing, isn't it? I mean, the idea that you could actually stop long COVID in its tracks before it gets started, I mean, that's obviously amazing. I mean, certainly something that concerns me is that, maybe I will get better. No, I will get better. But what happens if I got COVID again? Could I end up with long COVID Mark II? And like, that's such a horrifying thought, let alone anyone who, hasn't had long COVID to starters. So that's really great news. But I feel like you've given me so much hope actually tonight, which is amazing.
Well, I'm glad it came across that way, because really I think that's what my own perspective is, that medical research, science will pave the way to solutions for health that we don't have yet, but they're coming a little too slowly for my taste, and I think for most people, but they are coming. And so, focus on where the progress is rather than where the progress is not. That's one of the things that, in medicine keeps doctors hopeful. And if you think about like how many really difficult, horrible diseases there are, the way that we actually sort of stay hopeful and stay encouraging and really try to do the best for our patients is always to be able to look at where the sun rises, because tomorrow is going to be the new day. And I think that that's kind of what it's going to be like for long COVID. Finally, I think that, one of the things that, people should understand is that as we try to live with COVID, because it has no sign of going away, I was just writing about this earlier today. There is a important aspect of self-efficacy. Like we can take care of ourselves. We must take care of ourselves. And in the same way that, the idea of vaccination and masking has become controversial and politicized and polarizing, look, if you don't want to get pregnant and you don't want to get an STD, wear a condom. It's not 100%, but it's actually a much better protection than not wearing one. And I'm giving that example, kind of a stark example, because it's so simple that everyone would accept it. And that's why I'm actually bringing it up, not for the shock value, but for the simplicity value. And that's where we are with these basic treatments. Try not to get swept into the polarizing conversations. It's fairly simple. I mean, the disease is very complicated. What happens in your body is very, very complicated. With all those complexities that people are trying to figure out, like, let's not add any more and take it upon yourself to just sort of navigate the path so we can actually be as safe as possible.
Yeah.
Anybody else who especially wants to be interested in the not so medical technology, pharmaceutical side, one of the things that I do, if they want to learn more about food as medicine, is that I actually do a lot of work, and I put out a ton of information on my website. You can follow me on social. I'm always talking about foods that can actually amplify your health, and you can find my handle is at Dr. Dr. William Lee, LI. And, I do master classes. I do all kinds of free things that are really just trying to get information out there. I started this, by the way, at the very beginning of the pandemic, because I felt like the one thing that we need to be able to do is get reliable, trustworthy, scientific information out in ways that people can do something about. And certainly diet and lifestyle is something that, perhaps we've taken for granted for too long. But now certainly I think everyone's attention has been raised to the importance of health. And this is whether you are struggling with long COVID, whether you are actually recovering from acute COVID or whether you don't have COVID, these are things that we can all do for ourselves.
Yeah, definitely. And I will make sure I drop those links into the show notes. So if anyone's sort of frantically scrabbling for a pen right now, I'll pop it in the show notes. Well, thank you so much for joining me tonight. It's been absolutely fascinating. I feel like I've learned so much that my head's about to explode. So I hope everybody listening will have done as well. So thank you so much. And thank you for everything that you're doing to help.
Thank you.
Thank you so much to all of my guests and to you for listening. I hope you've enjoyed it, or at least found it useful. The Long COVID podcast is entirely self-produced and self-funded. I'm doing all of this myself. If you're able to, please go to buymeacoffee.com/longcovidpod to help me cover the costs of hosting the podcast. Please look out for the next episode of the Long COVID podcast. It's available on all the usual podcast hosting things. And do get in touch. I'd love to hear from you.